Hello, this is Dr. Latasha McElwain. I am doing a presentation today for Supervision on Black men and mental health. So, this is just an overview, continuation from our last month's presentation, Black women and mental health. All right, so the state of mental health for Black men. Right now, we're going to talk a little bit about the stigma of Black people. And I think we started out the same way with the state of mental health for Black women, also. We're going to give you an overview pretty much of what is kind of the stigma and the different things that go on, judgments, and all those other different things that go on in the Black community. So, Black people are more often to be diagnosed with schizophrenia and less often diagnosed with mood disorder compared to white people with the same symptoms. Okay, so that's a concern. That is something that, with me working in the field, I can agree with that. Sometimes I do see individuals with, similar symptoms, and I'll see a disorder that I'm just like, wait a minute, a diagnosis that I'm like, wait a minute, versus a diagnosis with someone else. And I'm like, and it's kind of the same thing. So a lot of times, this is something that from the research I've done has said that this happens a lot of times. So the other thing is stigmas and judgments prevent Black people from seeking treatment for their mental health. And that is something also that, me being a Black individual, knowing that things like that do come up, the stigmas and the judgments of if you go to receive mental health care or any type of care, therapy or anything like that, they would probably label a person, and I'm going to say in the next one here, considered crazy. So research indicates that Black people believe that mild depression and anxiety would be considered crazy in their social circle. Additionally, having discussions among friends and family regarding mental illness would be wouldn't be appropriate. So that is something that I myself can definitely relate to, growing up in a very close-knit family where I remember when I went into counseling and told my grandmother I was going to be a counselor, God rest her soul. She told me, well, baby, I don't know who you're going to do counseling for because, people don't air out their dirty laundry. So I definitely can relate to that comment, and I'm sure many others can relate to that comment also. And then when we're looking at Black men, mental illness are often undiagnosed or criminalized. So I think we all know that as a society as a whole, we realize that a lot of time if a Black man starts to have any level of emotions and different things like that, it might be underdiagnosed. And then I'm going to also say this, it could be overdiagnosed because certain things that a person might be doing doesn't have to be schizophrenia all the time. Or the individual could be actually in a position where it would be what they're displaying is criminalized, as in they're too loud, they're aggressive, and they're showing, doing different things or, doing some type of activity that is being considered, they're criminalizing it. So with that being said, I think all of those areas that we're talking about, and we're talking the state of mental health for Black men, we have to be concerned about all of these. When we're talking about about 74% of Black men have been exposed to a traumatic event and may have unmet mental health needs. That is kind of a big statement, I believe. And I believe it's such a big statement because it really attests to the fact that a lot of times when we're thinking about what's going on in the Black community, how can I say it? We realize, but then we kind of look at things and be like, oh, okay. But we have to realize that a lot of times there's a lot of trauma that happens in anybody's life. One of the things I always say is trauma is different for everyone. So a lot of trauma does happen in a lot of young Black men life, as well as, other ethnicity groups and other genders as well. But in the Black man's world, there are a lot of things that we're going to actually talk about in this presentation that really hits the fact of, even though that trauma is there, those traumatic events are there are unmet mental health needs, because there are certain things that go along with being a man in general that still shows up for, individuals, and they won't, again, talk about different things. Just the we just mentioned mild depression and anxiety would be considered crazy, and then talking about it amongst family and friends, that's just not appropriate. So a lot of times we have to, kind of look at all of these different things. We're talking about the state of mental health for Black men, and actually start to pick apart and start to connect the dots about what's going on, and why we are where we are at this point in time. So, moving right along, I wanted to talk about traditional Black men. So when we started talking about traditional Black men, I did this, basically a write up with research, and I also did some real personal questioning of Black men that I was around when I was actually working on this presentation, to come up with a lot of the information here. Or, a lot of them really concurred with a lot of the information I already had, and then, agreed that, yeah, these are things that is of a traditional Black man. So Black men, traditional ideal of the masculinity involves being stoic, strong, and self-reliant. That was something I found in research, and that was also something that I found just talking to the Black men that I did talk to when I was doing this. That, yeah, a lot of them are very stoic. They're kind of like, okay. They don't show emotions. They're pretty strong, and they're self-reliant. They're able to take care of themselves. Value is able to be placed on performing physical labor and having emotional strengths, and not mental or emotional intellect. So they don't have to worry about their mental or their emotional intellect at all, really. They just need to be able to restrain those emotions, and they need to be able to perform that physical labor. That's what value is placed on for the Black man. And that was, again, through research, and it was concurred by the Black men I did have a conversation with before I actually finished off this presentation. And then they should keep their inner struggles to themselves rather than seek services. The list above builds significant inner tensions, inner struggles, and emotional distress for them. So all this information that I'm putting together, all this, it definitely builds up a lot for a Black man to kind of deal with: the inner tensions, the inner struggles, and the emotional distress. The other part here, when we look at traditional Black man, to seek services is deeply rooted and ingrained mindset. So to seek services is a deeply rooted and ingrained mindset that you're not going to seek those services. So a lot of times they are not going to seek services because it's something that's already deep, deeply rooted in them, that that's not what we do. Almost like I said earlier when I said we don't air out their laundry, and as well as it's integrated into their mindset. So moving right along, I'm sorry, integrated into their mindset. Moving right along, talking about emotional unavailable. That was one of the things that talking with some of the men that I was kind of speaking to as I was doing this research. Emotionally unavailable is something that men don't really look at it as emotionally unavailable, but as we were talking, that's what we came up with, because I was just like, okay, so men sometimes emotionally, most men would be considered maybe emotionally unavailable, because showing emotion is not something that is of the traditional Black man, and everyone kind of agreed. So I threw that one in there, because when we're looking at traditional Black men in a setting, we're thinking about them being emotionally unavailable. I always think about some of the movies that we've seen, and then some households that we probably have experience with. A lot of time, dad goes to work, dad brings home the paycheck, dad does different things around the house. Dad isn't the one a lot of times that's sitting with baby boy or baby girl when they start crying about this, that, and the other. They have this big breakup or something like that. Dad is not emotionally involved in those things, pretty much. Dad really is a lot of times emotionally unavailable, and that's not just for a Black man. That could be for any man, because a lot of men are meant to be the provider in their homes. So that's a man, I think that's of a man in general. So just wanted to put that out there. Moving right along. So Black men don't. This is another good one. I was able to find some with working with a research, but then I was also able to get some good feedback on this one. So Black men don't. Don't share their deepest and darkest secrets, don't need help. Seeking assistance is a sign of weakness versus courage or strength. So they don't seek help because they feel like it'll be considered weak versus saying that, oh, but I can share. I have the courage and the strength to, and I can. No, that's not how it goes. Um, Black men don't do therapy. Black men don't air out their dirty laundry. Black men don't show their feelings, and Black men don't cry. They suck it up. So this is kind of like Black men, but it's also men in general too, because some of these can definitely be related to men in general. We're talking about the masculinity of men. So I wanted to add that in there just to kind of give that aspect of it. But to be honest with you, this is men in general also. So we're not just saying Black men don't, we're saying in general, men don't as well. Okay. So stigmas about mental health. So Black men tend to harbor feelings of mistrust towards the medical system. So medical and mental health system. So due to the abuse Black patients have had historically, definitely dealing with the Tuskegee and the syphilis study, that has created a definitely a historical event or experience that has created some mistrust, when it comes down to medical systems and mental health systems, anything dealing with healthcare. Okay. The fear to speak about mental illness due to the misinformation, stigmas, and it also deter people from seeking care. So a lot of things that you hear and a lot of things that go on with mental health, that's just, sometimes misinformation, and along with the stigmas as well, will deter people from getting help. They're not going to want to deal with this, that, and the other if this is going to be the horror experience or whatever the case may be. Excuse me. And then disproportionate diagnosis, underdiagnosing, misdiagnosing. A lot of times we have to be mindful of that, because this is actually direct results of racial and mischaracterized of Black people in general. Black people being categorized as angry, aggressive, dangerous, and things like that. This is also a part when we're talking about angry, aggressive, and dangerous, where we could also say that sometimes a person can be criminalized. So we have to be mindful of that. Basically, a lot of this stuff influences people response during a mental health episode. All these things come into play when we're talking about mental health episodes. Because when you have a mental health episode, we're going to see people get angry. People are going to be, very confused and not sure what's going on. So they might be aggressive. They might not even being more confused and more having, that inability to figure out what's really going on. They could become dangerous. But all that is what happens when someone is dealing with if they're having a mental health episode. That is not something that is untraditional for a mental health episode, so that's why I tell people all the time, you have to be mindful of things. And then when you look at the misdiagnosis, carries heavy stigma perceptions of violent behaviors, although schizophrenia is one of the ones that Black individuals, Black men, Black women, well, not really Black women, but Black men really are Black individuals, can be diagnosed with schizophrenia more often, but than their white counterparts. But when we're talking about schizophrenia is kind of like is often the victim. The person who has schizophrenia is usually the victim versus the perpetrator. They're not really doing a lot of violent stuff usually. Usually a lot of times it's someone doing something to that individual, when they're definitely dealing with schizophrenia. So there's a lot there that's really the waters get really murky, is like what I like to say. So studies show that 1 of 10 Black men are living with depression, but many more are struggling, and they're struggling in silence. And that is a true statement, I believe. Studies have shown it. Studies have definitely said that, we need to be mindful of that. So a lot of times, when we're thinking about what's going on with Black America, again, we mentioned silence from the women, mental health in women, Black women. We mentioned that silence. So here we go again, mentioning struggling in silence. All right, so more stigmas here about mental health. Stigma associated with mental health problems that prevent individuals from openly discussing their experience or seeking help. The misinformation and misconception about mental health in the Black community can further contribute to stigmatization, which hinder individuals from understanding the importance of seeking help. And then negative stereotypes, rejection, and mistrust of authorities are ongoing issues with measurable adverse consequences. So there's a lot going on there. This is a mouthful to me, but it's things that we need to be mindful of. All right, to statistical realities. I wanted to put this out there because I think this will help sum up with both of the presentations that I did to kind of give an idea. We're talking about men, of course, but then we got to think about the Black population in general. So in America, Black adults living below the poverty line are more than twice as likely to report serious psychological distress in the U.S. adults who enjoy greater financial security. So that was information that was given to us by the Department of Health and Human Services, Office of Minority Health. Then depressive symptoms among Black people are more disabling, persistent, and treatment resistant than white people. That was came from another research, the neuro psychiatric disease and treatment. Then looking up, getting some more research done, realizing that Black men do not receive the help that is needed for many of their daily struggles. So different things that are going on a daily basis, as well as those traumas that we were talking, those trauma episodes we were talking about. A lot of Black men do not receive help for that. Black men do seek out care. Black men that do seek out care would prefer having the same race provider. However, it is difficult to find a Black psychologist. Black psychologists make up about 4% of the doctoral level psychology workforce, and that came from the APA Center for Workforce Studies data. But this is the same thing we saw when we go back a presentation ago with Black women. We're not seeing that there are a lot of same race providers. And then now we're talking about a Black man. So we might be lucky enough to find a female psychologist or, psychiatrist or therapist, but finding a Black male, that could be definitely a struggle. Yeah. And then Black men's mental health are more complex than statistics or clinical diagnosis indicate, due to structural racism and Black men's unique history with this country. So all of us know kind of the history with this country and how things really kind of goes back all the way to slavery. Yes. And then again, we mentioned earlier on the research that was done for syphilis, the Tuskegee research that was done, where that's something that kind of haunts as well. So societal issues and disparities, we're looking at the history of slavery. So we mentioned that a little while ago. The history of slavery, that's the history that Black men have with this country. Black men arrest rate. So Black men are arrested, they're arrested and jailed, which translates to a social economic equalities. So basically when Black men are jailed for whatever reason, it does cause issues, and it's a social economic equalities. Yes, it does create that concern. However, a lot of times, again, like I said, mental health, instead of it being a mental health issue, it could also be criminalized so quickly in the Black community, Black men. All right. So we're also talking about societal issues as poverty, homelessness, incarceration, um, substance and alcohol use or abuse. And then we're talking about so all the high risks um, of experiencing poor mental health. So all of these are issues that really cause concerns. And like I said, we're going to talk a little bit more about, getting into what society has created and kind of how things go. So yes, we are going to be talking a little bit more about racism and different things of that nature, because that stuff, it does come up. So when we're looking at Black men risk factors, so we're looking at poverty, we're looking at financial worries such as poverty. We're also looking at systematic racism. So that's what I'm getting at, the systematic racism, the way the system is kind of set up. There is a systematic racism component there that we talk about, and I think some people try to brush it under the carpet a little bit, but it is something to really make you think. And then we're looking at police violence. That's another thing that's a risk factor. And then we're also looking at family and relationship issues. We're looking at traumatic experiences, the traumatic responses, the survival mode that is generational. That's something that happens from generation to generation, pretty much. The oppression, history to present day. We have to look at the oppression. We definitely have to consider the discrimination. We have to consider the social economic disparities. We have to look at the systematic inequalities. Excuse me. And then we also have to look at the health issues. So all those things are in place as risk factors for Black men. And we have to be mindful of those things, because those things definitely lead us into what are the barriers. We have barriers for mental health care for Black men. And those barriers, kind of play out because of a lot of those risk factors. It play out in the barriers, the things that stop us from getting help. So we look at factors such as pretty much we think the medical system is biased. And there is sometimes a certain level of bias on the medical providers or the mental health providers, because we already said that, the same symptoms from, Black man, Jimmy over here, and then white man, Jack over here, same symptoms, everything's going on. Jimmy's schizophrenic, and Jack over here is bipolar. Okay, so we're just looking at different diagnoses that are coming out of it, and it's due to there's a lot that's going on there, but this how it's kind of that, to me, that systematic racism. But we're looking at also we're thinking about the high poverty rate. We're looking at the low access to services, to quality psychologists and psychiatric services. So there's also some things that go along with that. We're also looking at most likely Black individuals in general, but I would say Black men also are more likely to use the emergency room and the PCP for mental health issues due to not receiving the appropriate preventative services. So using the ER and the PCP, meaning that you're going to go to your general doctor, your PCP, if you feel like your heart is just beating real fast and you feel like you're having a heart attack. ER, the same thing. But in actuality, you're having a panic attack, and that would be considered a mental health issue. But instead of having a therapist in place and getting some medication from a psychiatrist or getting the medication, you depending on how high of a level of anxiety you're having, you might be able to get your medication from your PCP, and that's it. But if things go haywire, you'll end up in the emergency room. But I say that to say, in any case, the preventative services out there would be to get yourself a therapist, have somebody you can talk to, also get yourself a psychiatrist, make sure you're okay, make sure your medication's right, and things of that nature. So those preventative services would not be in place. Lack of access to mental health services and lack of health insurance, not having the insurance to be able to even jump in and be able to, get the services you need. Demanding shifts for jobs. So jobs where you're working 8 to 5 or you're working whatever time, you cannot get off from work or you're working the night shift. By the time you get home, you sleep and everything else. So demanding shift work. That's another big one. Lack of services in the area where a patient lives. That's another big one, which I'm hoping telehealth is something that's going to help alleviate a lot of that, as well as no reliable transportation. Hopefully telehealth will be something that also can help with that, to alleviate that, and the lack of cultural responsive and appropriate mental health services. All right, moving right along with barriers, we're looking at, there's also documented racism and biases with the healthcare system. Many do not want to seek out services. Due to that, many people don't want to seek out services. They're definitely, researching and finding out what's going on, and they see those things happening, so they're like, and then also we're looking at historical dehumanization, oppression, and violence against Black people has evolved into present day present day racism, structural, institutional, and individual, and excuse me, and cultivates a unique level of mistrust and less affluent community experience. So there's a lot packed into that one right there, that also kind of, goes back from history to now, racism and slavery, racism, and in present day, the way things are set up in our structural systems and institutions. So yes, there's a lot there. Next one is historical adversities, as far as thinking about and going back to, again, slavery, sharecropping, and race based exclusion from healthcare, and then also education, social and economic resources translates to social economic disparities experienced by Black people still today. And then we're looking at, despite progress, racism continues to have a major impact on mental health of Black people. So we got to be mindful of those things. Why is mental health important for Black men? Okay, so living to thriving. So it's like, we want people to be able to thrive. We want people to avoid living in the survival mode. Just trying to make it. Okay, that's what we want people. That's what we want Black men to start to, get to that point where they're actually thriving. To understand feelings and emotion, developing that courage to reach out for help. Black men encounter unique barriers to finding cultural competent therapists, and that's because there's not a lot of Black providers out there, which we really do need. Some Black men may not be aware of what their emotions are, so with that, they're not aware of those emotions, and those are the symptoms of, that could be definitely related to depression or anxiety. So sometimes they just kind of, I'm just in a bad mood, or, oh, I'm just, a little jumpy today, So a lot of those things sometimes really do, lead to having some issues and some concerns when it comes down to anxiety and depression. And it could be overlooked. Okay, so Black men taking care of their mental health and healing. We're going to talk about pretty much access to care and resources. We're also talking about developing support groups, regular medical and mental health wellness checkups. Definitely looking at developing a group of peer supports, like people that are kind of dealing with some of the same thing, or Black men that are friends, or can support each other, seeking professional mental health services, getting good rest, just being able to relax and take care of yourself, eating more, eating well, having good body movement, doing some level of movement throughout the day, connecting more with others, meditating and other physical activities, and then knowing what your limits are, knowing when to say when. Black men coping with mental health also exercise, stretching, new movement activities, walking, gardening, new exercise routines and exercise journeys, outdoor activities, sports, hydration and nutrition. Definitely working on getting your waters in, and definitely being more moderate with food intake. And again, that could also talk about fasting and things of that nature. Writing, it could be journaling, there could be poetry, short stories, memoirs, again, scribble doodle in a notebook. Begin an educational journey. So finding something new that you like and something that will challenge you, and you want to learn something different. So a lot of people are trying to do new languages and things of that nature. Watching comedy, having a laugh. Laugh is good medicine. Um, Singing, playing instrument, sometimes even learning to play a new instrument, listening to music, dealing with different genres of music. Also looking at reading a good book, just kind of getting things that you're really interested in, meditation, prayer, creating vision board. And when I say vision board, some people are really into, making sure that they're creating a good vision board, and they look back at it and realize, oh my goodness, this is exactly what I said I wanted, to do, and it happened for me. So we're talking about Black men finding support. So again, contacting the primary care provider and also contacting the health insurance to find out if they have culturally competent providers that are in network. Another thing to look at is our local support groups that could be in the community, church work, or different social group areas. And then looking at researching local therapists, counselors, coaches that have that cultural experiences, or they have that cultural expertise. So again, exploring community mental health resources and seeing what's out there and what could be accessible. So I did find 4 or 5 mental health videos that I thought was really, really interesting and gave us some real great viewpoints to think about. And all these videos talked about men. I think all of them were by men, I think, and one of them was by a female. The female talked more about the history of African Americans or Black people in America. And she really, hit home. So I thought that was a really great video to have here. And then the other ones were all of men speaking of their experiences and speaking of how they move to a point of being able to do what they're doing, whether they're an advocate, whether they're a therapist, whether they're, whatever they're doing in the mental health realm right now, they're talking about how they got there. And most of them are talking about experiences they had that could have been traumatic type experiences. So I think those videos are really great videos that I want everybody to take a minute and just be able to look at. So these are, like I said, some really good ones I found. In conclusion, we want to look at Black men and mental health as far as thriving, healing, and living in a good way, having that good living, that soft living, being able to be comfortable in your skin. That's a lot to ask for. I do understand that in the state of the world that we're in, but I do think that that is something that we all would love to see Black men, Black women, everyone thrive towards, as far as getting to the point where they're healing some of those things and they're able to live in where they can breathe. The other part of it here is talking about having that health over the hustle, taking care of you first. This is a lot of stuff that we did talk about from the women and Black women in mental health as well. But with Black men, it's some of the same thing. Understanding, changing, and avoiding that trauma response. Getting to the point where you don't have to, respond in that way or feel that threatened and things of that nature. Avoid holding everything in. Sharing, being able to share, please share. Understanding your strengths. Discover, develop, and know your value. And sometimes debunking some of what is quote unquote traditional male or traditional female. Sometimes we have to debunk some of that stuff for us to realize what our value really is. Because if we sit here and continue to think of what society tells us we should be versus what we feel like we are, then we're kind of just going along with what somebody else says, not feeling that we can be our own who we are. So that's, something to think about. And then understanding what support's needed and actually getting the support. Men's circle, talking about inclusive cultural circles where you can feel seen, heard, respected, and value, and having a safe space. Having a safe place or a safe space is a big buzzword lately. Safe space where individuals can feel like we do matter, we do have a voice, journaling, and also protecting your mental health. Another thing you can start thinking about, some of the same ones we still have for the women as well, but this one is talking about loving yourself, being passionate and discovering hobbies, different things you like to do, being selfish, as in loving yourself, loving on you, showing emotion and understanding your emotions. So understanding why you're feeling angry about something, or understand that something has been triggered and why it's been triggered, and where you would like to go with all this why that you're learning and understanding. And then being aware of your emotions and addressing them, also another big piece as well. Exploring your emotions honestly, as in being able to express them, show them, and be able to explore, okay, so what does that mean for me? Or, just being able to be in that space. And then seeking out clarity of your emotions. That's another one. Allowing other people, other individuals, or allow caring for you and allow support to you. So allowing other people to come in and say, hey, how can I help? And being willing to accept it. Reach, and then being able to reach out for help too and accept that care. So if someone say, how can I help? Allow them to reach out and say that. But then when they do reach out, or you're at that point where they are reaching out, accept the help, say yes, you can help me. Or if you feel like, okay, this person has asked before and I've kind of turned them down and wouldn't allow them to do anything for me, this time, yes, I'll accept your help. Ask them, hey, is there any way you can help me this time? So those are some things just to consider. I did put in a few of the references where I got a lot of the information from here, but again, we're going back to basically just talking about the whole Black community and making sure that we are, highlighting the state of mental health for the Black community, whether it be the Black female or it be the Black male. We are looking at the whole dynamic of it, and really wanting to make sure that everyone know that yes, you have to take care of yourself. What you think and what you do and how you care for yourself, it does matter. So that's the end of this presentation. Again, this is Black men and mental health in Black men. So this is, again, for the purpose of supervision only. This is just an overview of kind of where we are in the state of, the state of what we're doing. The state of mental health for Black men, state of mental health for Black women was the one previous. But again, this is where we are so that we can bring some awareness. Thank you so much. And I hope you really enjoyed this. If you have any comments or anything like that, you can definitely let us know and we'll go from there. Thanks so much and have a great day.